Coughs are a common sign of childhood illness, and many times when a parent hears that their child has begun to cough, they start to get really nervous and they're wondering what's going on. Sometimes it's just a normal part of the process, especially when it comes to the common cold. And actually, a cough can be our body's way of trying to clear our airways and helping to make sure that we can breathe. So it's not always a bad thing. And it is normal if your child has had a cold to have a persistent cough for a couple weeks after, because they'll continue to cough until their airway has totally healed. So it's normal if you're noticing an occasional cough after your child has had some sort of respiratory illness in the past. So with all that said, when is a cough concerning? For children who are 3 years of age and younger, if they develop a barky cough, like it kind of sounds like a seal barking, that's usually a cardinal sign of the croup, and that's caused by airway swelling, and your child should be seen by a doctor if this isn't getting better. It usually comes on in the middle of the night, and if it's cold outside, you can take them outside and let them take a few deep breaths of the cold air, or take them into your bathroom, turn on the shower, and let them inhale that warm, moist air, and that may help them a little bit. If it doesn't calm them down, they're still having this barky cough, then you should have them seen as soon as possible, because their airway can continue to swell and it could be potentially dangerous. Pertussis, also known as whooping cough, is another concern if a child has a chronic cough that's just not going away, especially if they have back-to-back coughs where they're not breathing in between, and at the end of the coughing spell, they make kind of a whooping sound as they breathe in. If your baby hasn't received the Tdap vaccinations, or they're younger than a year of age, then it would be best to talk with your doctor if you have any suspicions of this, because they can look into it and decide if further investigation or treatment is necessary. Whooping cough can be potentially serious, especially for young children. It is a preventable illness, and if you vaccinate your child against it, and you also receive vaccines to keep your child from being exposed to it before they're able to get their own vaccinations, then the chance of them getting it is very slim to none. Other common causes of cough can include allergies, asthma, and even reflux. So if your child has been coughing for 3 weeks or more, then talk with your pediatrician, and after asking you more specific questions and performing an exam, because one of the best things to do is to actually listen to the cough, they can decide if further investigation or treatments are necessary for your child. Also have your child seen by your pediatrician if they're running a fever of 102 or greater, if they're coughing up blood, having a hard time breathing, for an infant if they're breathing 40 times a minute or greater, if you notice that they're wheezing, if they have that barky cough, or they act dehydrated, they're excessively cranky, or have other symptoms that you're concerned about, it's always worth getting it checked out. If they say that you're okay to just continue to monitor your child, then there are some things you can do at home to help support them through it. Get a cool mist vaporizer in your home. Adding moisture to the air can help. Do a steam session like I talked about earlier, where you just go into the bathroom, shut the door, turn the shower on hot, and sit in there with your child and let them inhale the warm, moist air. If they have a barky cough, like I mentioned before, take them outside and see if that helps a little bit, and make sure they stay well hydrated, because especially if they have a lot of secretions, if they're well hydrated, then that will help the secretions to loosen so that their body's able to work them out. Avoid giving your child cough medicine if they're 6 years of age or younger, unless directed by your pediatrician. And if you're thinking about giving them anything over the counter for the cough, be sure to talk with your doctor first. They can make sure it's safe and that it's given to them in the appropriate dose if they determine that it is safe. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.